About 30 to 40% by many estimates of strokes will occur not because of problems within inside the brain, but problems related to blood circulation to the brain, which comes primarily from the carotid arteries in the neck. And these arteries are very amenable to surgical correction or correction by angioplasty and stenting if the diagnosis is made. The common symptom in layman's terms is the mini stroke. It's called a TIA, which stands for transient ischemic attack. The other common symptom is a temporary visual disturbance, like a shade coming down over your eye that causes loss of vision in that eye for a few minutes, and then a return of vision. That's called a transient monocular blindness, or amaurosis fugax. Those are the classical terms. So those are the two symptoms that patients need to be aware of, so that if they have those signals as a pre-stroke kind of a warning, they can go on to have their carotid arteries evaluated. The other way of making the diagnosis is to make sure that on examining the patient, the physician is always listening to the carotid artery in the neck, because there is a noise in a diseased artery called a bruit, which is very easy to pick up with a common stethoscope. And if that diagnosis is made, then the next step in terms of managing the disease can be taken readily, cheaply, and non-painfully with an ultrasound. The ultrasound doesn't require radiation, it doesn't require punctures, it's totally painless, and it's very accurate in, number one, confirming the fact that there is carotid disease, and number two, grading the severity of it. And once that determination is made, then the next decision in terms of medical treatment with drugs that prevent clogging of the arteries, or angioplasty stenting to open up an artery, or surgery called surgical carotid endarterectomy is appropriate. If those treatment modalities are instituted in time, you can prevent the development of a full stroke.